Bleeding could be external, you can see it, internal, you can't see it, or both. If someone is bleeding heavily, you need urgent medical help from the emergency services. You need to stop the blood flow by putting pressure onto the wound immediately. Having the person sit down or lie down and raise the wounded part above the level of their heart contributes to reducing the flow of blood to many types of wound. Since severe bleeding is likely to result in shock, you need to know about and watch out for the signs and symptoms of shock, which we'll come to later. Nosebleeds are a common problem and often dealt with quite straightforwardly. In the event of a nosebleed, sit the person down. Tilt their head forwards. Ensure they breathe through their mouth and refrain from sniffing or sneezing. Pinch the soft part of their nose just below the bridge. A dressing may be necessary to absorb the blood. Stay like this still for about 10 minutes. If it has not stopped, then start again. When it has stopped, clean up with warm water. If the nosebleed is severe, lasts for more than 30 minutes or follows a blow to the head, get them to a hospital. Regular nosebleeds need medical advice. It could indicate an underlying problem. If someone has a cut or graze, clean the wound with cold running water. Dab it dry with a gauze. Cover with an appropriate dressing. Avoid putting dressings or plasters on minor grazes where safe to do so, as they will heal faster with fresh air. Generally, cuts and grazes are only of concern if, for example, some kind of foreign object is embedded in the wound. The bleeding continues. They're caused by a dirty object. They're caused by an animal. Typically, most bruises disappear within a few days and are generally harmless. If a bruise looks like it will be large, apply a cold compress for half an hour or so to help contain the bruising. A painful bruise which gets worse after 24 hours could indicate a fracture. Therefore, it's wise to seek medical advice straight away. Bruises may also indicate abuse. Therefore, be vigilant. And if you suspect abuse, follow your organisation's procedures on responding to suspected abuse. You should have had detailed training about this. Most head injuries have no problematic consequences. However, many head injuries can have negative consequences, and some may have severe implications. Therefore, when someone has experienced a head injury, no matter how insignificant it may seem, summon a trained first aider who will take charge of the situation. If someone has had a head injury, stay observant for warning signs that things are not good, which could include, for example, loss of consciousness for any length of time, vomiting, exceptional drowsiness, a bad headache or pain, loss of blood from the nose, mouth or ears, any straw-coloured fluid coming from the nose or ears, any injury to the scalp which may suggest fracture to skull bones. If you suspect such, summon a trained first aider who will take charge of the situation. After a head injury, even hours later, temporary unconsciousness or incapacity can occur, which is known as concussion. Symptoms may include dizziness, headaches, nausea, and vomiting. If you suspect concussion, inform the most senior person on duty immediately. Since eyes are delicate and easily damaged, eye injuries should be treated with care. If someone has an eye injury, encourage them to stay still. They may need a pillow to support their head. Where appropriate, a first aider might give them a non-fluffy dressing to hold over their eye. Keeping the eye closed may be appropriate to stabilise the situation. Encourage them to keep their uninjured eye as still as possible, as this helps to keep the injured eye still, which may prevent further damage. As you would expect, seek medical assistance. Any break to a bone or part of a bone is known as a fracture. All fractures require hospital treatment. Health and social care workers should be observant for situations, signs and symptoms that someone may have a fracture, including, for example, the area being less mobile, bruising, deformity, pain, swelling. The two main types of fracture are a closed fracture, where the bone breaks and remains under the skin, an open fracture, where the bone breaks and appears, breaking through the skin. If you're ever in doubt that a fracture has occurred, work with the person as though it has. Better safe than sorry. Where you work with older people, you might encounter a situation where someone could have fractured a hip or pelvis, often as a result of a fall. Since the fracture may not show itself for hours or even days, you must observe the person closely, keeping an eye out for difficulty passing urine, pain, shock, walking difficulty, walking to one side. If in doubt, inform the most senior person on duty immediately. Another problem you might experience is where a joint has been displaced, come apart. This is known as a dislocation. Not only is this extremely painful, the casualty may experience bruising, difficulty moving the joint, disfigurement, swelling, twisting where the injury has occurred. Neither you nor a first aider should attempt to put a dislocated joint back into its correct place, as this may do more harm than good. The first aider will encourage the person to keep the injury still, immobilised, whilst waiting for professional help to arrive. Spinal injuries can occur for a variety of reasons, including, for example, falling awkwardly, falling from a height, falling off something, for example a bicycle or horse, a heavy object falling on someone's back or neck. If for any reason you suspect that someone may have injured their spine, do not move them. Wait for professional medical assistance. Once more, it is better to err on the side of caution. Symptoms that could indicate a spinal injury include, for example, an abnormal-looking or twisted spine, burning or tingling sensations in the limbs, difficulties breathing, loss of bladder or bowel control, loss of control or sensation over limbs, neck or back pain, tender skin over the spine. As you would expect, if you think that someone has a spinal injury, summon a trained first aider immediately, whilst reassuring the casualty. You will know that ligaments, muscles and tendons can be strained or sprained, symptoms of which include bruising, discomfort, reduced mobility, pain, swelling. Since some of these symptoms are similar to dislocated joints or fractures, if in doubt they should be treated as a fracture. This will certainly include resting, immobilising the injured area and reassuring the person whilst professional assistance is on its way. Often bruising, swelling and other problems result in heat being generated, which makes the problem the casualty has experienced feel worse. Clearly, reducing that heat helps the person to feel better, and this can often be done with an ice pack. To make an ice pack, half fill a plastic bag with ice. Wrap it in a clean tea towel. Place the ice pack on the affected area for about 10 minutes. If the ice starts to melt, change the ice in the bag. Never put an ice pack directly onto the person's skin. It needs to be wrapped in a clean, thin towel first. Cramp is a sudden, painful spasm in a limb. It should ease after a few minutes and can be eased by massaging the affected area. A stitch is a cramping pain which occurs in the muscles at the side of the chest, generally due to over-exercising. Normally, resting for a while is enough for the stitch to go, but if it continues, medical advice should be sought. In elderly care, you should know that an elderly person's skin may be more sensitive to the effects of the sun due to body changes as part of the aging process. This increases sunburn risk. Preventing sunburn is essential, for example, finding suitable shade and sunscreens. When out in the sun, always use a waterproof, non-irritating, hypoallergenic sunscreen, at least factor 15, higher if appropriate. Also remember that winter sun can be just as dangerous as summer sun. Unfortunately, if someone is suffering from sunburn, responses include, for example, get them out of the sun, ideally indoors. Sponge the affected area gently with cool water. Allowing the cool water to evaporate off the skin helps cool the skin. Give them frequent sips of cool water to prevent dehydration. Someone in an environment that is too warm might sweat too much, thereby losing more body fluids than they're taking in, which may lead to what is known as heat exhaustion. If a person overheats and their body's natural cooling mechanism breaks down, they can experience a stroke known as heat stroke. Heat stroke is serious. The person may lose consciousness, even die. If you find someone whom you suspect is suffering from heat stroke, summon a first aider immediately and have the most senior person on duty notified. Urgent medical assistance will be necessary. Not only is being too hot dangerous, so too is being cold, which can result in what is known as hypothermia. Hypothermia can develop if, for example, someone has been in cold water too long, someone has been inactive for a long time, someone has been exposed to the cold for a long time, outdoors or indoors. Older people and children are especially vulnerable to hypothermia. Since many older people who live at home can be particularly vulnerable to hypothermia during colder winter months, stay observant for symptoms such as a slow, weak pulse, cold, pale, dry skin, disorientation or odd behaviour, impaired consciousness, shivering, slow, shallow breathing. To treat someone who has hypothermia requires gradual, not quick, re-warming. For example, replace wet or damp clothes with dry ones. Give them a warm, not hot, sweet drink. Cover them with layers of blankets, extra clothing. Hold them physically close to you to share your body warmth. Having them put on a hat can help them to retain warmth. Do not expose the person to a direct source of heat, such as a hot water bottle, to help warm them, and never give them alcohol. Once they begin to recover, keep them warm and monitor their temperature to make sure they neither overheat nor become cold again. Seek medical intervention. Burns can be caused by heat, chemicals, or electricity, which may affect the treatment required. There are basically three types of burns. Superficial, sometimes called first-degree burns. Intermediate, sometimes called second-degree burns. Deep, sometimes called third-degree burns. Superficial burns involve only the outer layers of the skin, causing redness, swelling and tenderness. Usually these types of burn heal well. Intermediate burns involve the top two layers of skin, which can blister and become infected. Deep burns involve all layers of the skin and considerable loss of body fluid. They may take a long time to recover, and scarring is likely. The shock associated with being burned, particularly intermediate and deep burns, also has to be addressed as part of first aid response. Always summon a first aider immediately if someone has been burned. Any kind of chemical, including cleaning products, can potentially cause chemical burns, symptoms of which could include, for example, blistering, discoloration, intense pain, swelling. If someone in your setting has a suspected chemical burn, summon a first aider immediately. Be careful not to contaminate yourself with the chemical. Have someone get the COSH safety data sheets for emergency advice. Sadly, clients swallowing substances hazardous to their health is not uncommon in health and social care settings. For example, swallowing chemicals, cleaning agents, drugs, insect controls, rodent controls. Symptoms vary depending on the substance swallowed, but typically include, for example, burning pains, vomiting, nearby evidence such as an empty bottle, lack of consciousness. If you suspect that someone has swallowed a dangerous substance, summon a first aider. Have the emergency services called. Do not encourage the casualty to vomit, as bringing the substance back up could cause more harm. Have someone get the COSH safety data sheets for emergency advice. A client might be poisoned by drugs or alcohol in a variety of ways. For example, medication administration error, an inappropriate change in medication, accidental or intentional overdose, an adverse reaction, illegal drug use. Symptoms will vary depending what has been taken. Therefore, if you suspect that a person is suffering from drug or alcohol poisoning, summon a first aider immediately, have the emergency services contacted, keep any evidence that indicates what they may have taken, give this to the paramedics as it could save the person's life. Food poisoning can occur if food has not been prepared, cooked or served properly, and unfortunately occurs in health and social care settings. Some common symptoms of food poisoning include, for example, abdominal pains, diarrhea, shock, symptoms of a fever, vomiting. If you suspect someone is suffering from food poisoning, summon a first aider. Have the most senior person on duty notified immediately. Since food poisoning can kill people, it is a serious matter, and why all health and social care workers who handle food in any way must have appropriate safe food handling training. During a heart attack, the blood supply to a heart muscle is obstructed, which in turn causes the heart to stop. Symptoms of a heart attack could include severe chest pain that often spreads down one or both arms. Breathlessness, the casualty often gasps for air. Lips go blue. Skin goes ashen. They become sweaty and clammy. They feel faint or dizzy. A sudden collapse is possible. If someone is experiencing a heart attack, summon a first aider. Have the emergency services called. Sit the person in a half-sitting, half-lying down position. Prop them up with pillows or other soft items to make them comfortable. Loosen their clothing. If someone has an angina attack, respond in the same way as you would for a heart attack. A stroke can occur when the blood supply to the brain is impaired, resulting in symptoms which could include, for example, confusion, difficulty swallowing, loss of consciousness, loss of limb movement, speech difficulties, sudden painful headache. If you suspect that someone is suffering from a stroke, summon a first aider, have the emergency services called. A number of health and social care settings work with clients who may experience seizures or fits. They occur when a disturbance in the brain causes body muscles to move involuntarily, either as a result of an accident or by a condition such as epilepsy. Some of the symptoms of a seizure may include convulsions, rigidity, a bitten tongue, the person stops breathing, unconsciousness. Your organisation will probably provide you with specialist training in responding to such situations if they are a regular feature of the client group you work with. One of the most common features of many first aid situations, as you will already have realised, is shock, not only for the casualty, but possibly for other people involved as well. Don't underestimate the implications of shock. For example, occasionally, shock can be more serious than the incident itself. There are many causes of shock. Here's just a small number of examples. Anaphylaxis, bleeding, burns, diarrhea, drug overdoses, heart failure or heart attack, hypoglycemia, hypothermia, infections, vomiting. Therefore, not surprisingly, there are a wide range of symptoms to look out for, which could include, for example, anxiety, rapid or shallow breathing, clammy skin, dizziness, gasping for air, grey-blue skin tone, nausea and vomiting, rapid or weak pulse, thirst, weakness. Anaphylactic shock is a severe, often dangerous allergic reaction, which can be caused by, for example, an insect sting, certain drugs, latex allergy, some foods such as nuts. Depending upon the individual and the cause of the allergy, symptoms vary, but could include, for example, a drop in blood pressure, attempts to cough, blueness around the face and lips, difficulty speaking and breathing, high-pitched wheezing sounds, swelling of the tongue and throat. If you suspect that a person is having an anaphylactic shock, summon a first aider. Have an ambulance called immediately. Follow the instructions of the first aider. When an asthma attack occurs, muscles in the lungs go into spasm and airway linings swell, which causes them to narrow, therefore breathing becomes difficult. Some signs that someone may be having an asthma attack could include, for example, a blue tinge to their face and lips, coughing, difficulty in breathing, wheezing when breathing out. One of the benefits of becoming a qualified first aider is knowing how to respond to an asthma attack correctly. Another commonly experienced situation for health and social care workers is encountering someone who is choking. Signs of this might include, for example, a choking sound or an inability to make any sound at all, a flushed neck and face, an indication made by the casualty that they are choking, for example, holding their throat, difficulty breathing, their skin going blue. Only someone trained as a qualified first aider should aid someone who is choking. Both vomiting and diarrhea can cause a person to lose body fluids, which may lead to dehydration. To prevent this, the person needs to drink plenty to replace lost fluids and prevent dehydration. This should be done by sipping fluids little and often, rather than drinking a lot at one time. If vomiting or diarrhea has been regular or ongoing, seeking medical advice may be appropriate. Headaches are common complaints, generally treated with rest and sometimes applying a cold compress if desired. A headache may be a cause for concern if consciousness is impaired. The person's neck is stiff as well. It follows a head injury. It's associated with fever or vomiting. It comes on very severely and suddenly. A migraine is a severe headache that is often accompanied by nausea, disrupted vision, or intolerance towards bright lights. If someone is suffering from a migraine, encourage them to rest and take any migraine medication prescribed for them, allowing for proper medication administration practices. For most of us, generally an insect bite or sting causes no more than a sore or itchy minor swelling. But for some people they are extremely dangerous, bringing on an anaphylactic shock. Symptoms of an allergic reaction to an insect sting include breathing problems like wheezing and gasping for breath, puffy eyes, red blotchy skin, swelling at the site of the sting and/or the person's face and neck. Never undertake any type of first aid that you have not been specifically trained to do on an appropriately recognised first aid course. In the vast majority of cases, common sense will tell you the seriousness of an incident and whether professional medical help is needed. Keep it simple and don't make a bad situation worse. Above all, don't do anything that you're not appropriately trained and approved to do, and then only in accordance with your organisation's policies and procedures.